board certified dermatologist. Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer your most troubling skin questions. Let's get right to it. The first question that we have here is from Amy in La Mesa. Amy wants to know, I've never smoked before, but I have wrinkles above my upper lip. What can I do to get rid of these wrinkles? And I believe we have a picture to show of exactly what she's talking about. Yeah, you can see them right there, huh?
Right, yeah, this is a really common complaint. And interestingly, not a lot of women that come in with this issue were never smokers. In fact, these lines can be related to decreasing estrogen levels over time. So what we can do for these women is do a laser resurfacing procedure. And the new lasers we have enable us to do that with very minimal downtime and get an amazing result, really. And I think we have a before and after picture to look at of a patient that I resurfaced recently.
This is Amy right here from La Mesa with this is the difference after how many procedures?
This is just one treatment. You can look at her upper lip and actually all around the mouth, and you can see how it reduced lines and actually tightened the skin around the mouth.
Yeah,
so
it's pretty dramatic.
A one-time treatment, we can get some pretty substantial results.
All right, we have another question from Hannah, I believe, in Chula Vista. And Hannah wants to know, with spring break approaching, I'm thinking about bikini season, isn't everybody? I have a small pooch on my lower stomach. Is there something that I can do besides surgery to reduce this fatty area? This is a problem that a lot of women have, and this is her actually showing it right here. So what did you do with her?
Yeah, this is a great question. So for these patients that don't want surgery, they don't want to do liposuction, which would be a good option, but something non-surgical we can do is called CoolSculpting. This technology has been around for about 3 years, but the great thing about it is there's no downtime, it's painless, and it'll reduce the thickness of the fat in the treated area by about 25% with one treatment. And you start to see the improvement in about 4 weeks.
And
so pretty awesome.
Let's show that picture right there. What are we talking about cost-wise for something like this?
So for the lower abdomen like this, the cost would run for one treatment about $1,200 to maybe $1,500.
Okay.
So not bad for such a nice result.
Yeah, you can really see it right there. All right, let's go to our next question, which is Christian from El Cajon. Christian wants to know, I've noticed a mole on my face that looks odd to me. How can I tell if it's cancer?
Great question, Christian. The good news is when I look at your picture here that this looks benign and harmless to me. Now, if there's ever a question, it's always best to go in and see your dermatologist, but the things we look for, we call them the A, B, C, Ds of moles. So the A stands for asymmetry. So if there's any asymmetry of the mole, which there isn't in this case. B for border irregularity, and you can see the border's nice and smooth in this case. C is for color differences. You can see this mole is nice and uniform in color, so not concerning. And then D is diameter, which would be bigger than a pencil eraser, and this one looks like it's not. And
I think we have another picture to show maybe that kind of features the ABCs of moles. It's really interesting because you talk about the shape of it. If it's got kind of a shape that's sort of going, the border sort of going out and not round, you can see it right there. That might be something that you really need to get checked out, right?
And the best advice, it's so easy to biopsy these spots. Just a little Novocaine, take a little piece of it and send it off to the lab. So if there's ever any question, please come in.
Okay, let's get to this question now. Lillian from Escondido wants to know, I'm 56 years old and I have age spots on my hands that make me feel older than I am. What can I do to get rid of them? A lot of times you take such great care of your face and your neck, but your hands are the telltale sign.
Yeah, it gives it away. So, and a lot of times what we do is we put sunblock on our face but not our hands, so they get more sun exposure, which will cause those brown spots. So again, the great news is there's a treatment for this, and my favorite treatment is using what's called an alexandrite laser. With one treatment, we can get about 90 to 100% clearance of those spots on the hands with really no downtime. After the treatment, the next day, the spots will actually look darker, and then over a period of about 10 days, the spots gently come off the skin, like in this patient's case. So this was one treatment that I had done on this patient. You can see probably about a 90% improvement.
Interesting. And how much are we talking about price-wise for something like this?
For the hands, it's probably in the $500 to $600 range.
Okay. So speaking of sunscreen, we have another question about sunscreen. This one is from Carrie from Vista. Carrie wants to know, I enjoy going to Balboa Park with my dogs and never think twice about using sunscreen. What? I normally stay under a tree, though. I wear a big hat, but do I need to use sunscreen? If so, what do you recommend?
Well, I love the fact that Carrie's smart enough to wear a hat.
Sure.
And she's trying to stay in the shade, but she should still use a sunblock because you can still get rays from reflection off the ground and things like that. So the best kind of sunblock is to find one that's got mineral blocking, which is zinc and titanium. So the easy thing to do is to grab your sunblock and look on the back and look at the ingredients and see if it contains zinc or titanium. If it does, that's great, and that's what I would go for. And also, the other thing you want to do is find a block that's 30 or above.
Okay.
Yes.
Those 15 SPF.
Not quite enough.
What about the 4? My husband tries to use 4, and I'm like, what are you doing? That's nothing.
If you want to burn, I guess that might be a good choice. But no, not a good choice. The best is actually a 50. Anything above a 50 is probably not going to help you any more than a 50 would. So just stick with 50 or 30 is good too.
If you'd like to get in touch with Dr. Groff, the info, we're going to put it up on your screen right there. He's located in the UTC area, Genesee Avenue. Phone number's on your screen as well. And we posted a link on our website. Just go to fox5sandiego.com.